What is up, Smashers? Guess what? It's another day at Delta. Again, it's a super awesome workout this morning. It was a bunch of snatches, some double unders, some pistols, and guess what we're going to be talking about since we did pistols? Ankle mobility. Now remember what I said, that knee problems, I'm going to have you clear out your ankles because most knee problems are actually hip mobility and ankle mobility issues. The knee is a simple hinge joint. It moves just like this, except with the last 5 degrees. There's something called the screw home mechanism where the knee actually rotates slightly to lock into place. For example, you get to the top of a snatch, you lock out in the top of a squat. It doesn't matter, all that stuff, it has that screw home mechanism. But other than that, simple hinge. So we're gonna fix the ankle mobility so your squat is better, your knee mechanics are better. And if you follow the guys over at Squat University, by the way, they were talking about hip mobility and how important it is. You got that tripod position, right? Heel, big toe, pinky toe. We have that. Your weight's supposed to be balanced in between that, and a lot of times it's not. We tend to ride forward on the foot or sit backwards on the heel instead of nice and dead center where that tibia drives right down in the middle. So what we're gonna do is we're gonna free up that ankle, clear out those 26 bones, let your foot adapt to the terrain. And let me pull this away a little bit so you don't just see my big fat head in the middle of the video. So we're gonna do the front of the ankle, the back of the ankle, and then I'm gonna show you the funkiest mobility ever. Super, super gnarly, super painful, but super effective. It's gonna clear out the soleus and the gastroc and peel those apart. Remember, the soleus goes around the gastroc, and it's what dorsal or plantar flexes that ankle, but it's gonna lock out that Achilles a lot and keep you from dorsiflexing your foot, so you can't drop into the bottom of that squat, and you tend to come up on your toes. So check this out. I'm going to grab a J hook. Actually, we're going to use an Eleiko. Super crazy. You love my camera stuff, huh? This is my super quality camera gear. But we're going to use that as a camera stand. We're going to come just like this. So you can see. Now, I'm not going to load the band up a lot just because it's sitting on a mobile rig. So the stands are going to slide around, but I want you to load this up, good 60, 70 pounds. We're going to do the posterior and the anterior. So we're going to get that talus in the front of the foot to start to tuck. So the dome of that talus has to tuck back so the tibia and fibula can allow that foot to come into full dorsiflexion. Now, it's super important. So we'll kick off the shoes. I think there's a song like that. First thing we're gonna do is we're gonna kick inside. This is such easy stuff. It's easy to do, it's easy not to do. So I'm loading up, I'm testing the integrity of this actually standing here without eating it. So all we're gonna do is you're gonna have the band dragging forward. So we're gonna have it just right on the base of that heel. Yeah, see, now the stand moves. And then we're just gonna come forward as hard as we can. The band is gonna help drag that the top portion of the ankle, the tib and fib. It's going to drag it across the top, and it's going to recover a lot of that dorsiflexion. Most important part is that heel is stuck on the ground. That band is loaded up about 70, 80 pounds, and then you're just going to scour around. That's number one. Number two is super easy, but I'm going to switch feet. Now it's sitting on the anterior portion of the foot. I want this right where the crease is in the ankle. And then you're just gonna take that, load it up again. And then the big thing is, I want you to hunt around. So scour around. Don't just go back and forth. Come on, you can step up just a little bit. Because this, oh, that's just sissy. Come on, you got more than that. That's just sissy. I even just did this and it kind of made me feel a little wimpy. So scour around for those really ropey, matted down spots, because that's gonna allow that foot to do what it's supposed to do, which means your squat gets better, the knee pain goes away. It's that simple. And you're just gonna hunt like that spot right there. You're just gonna scour around. Go ahead and push that out. Just make sure the heel stays on the ground. That's number two. And number three, man, part of me doesn't want to do this one because it is incredibly awful. You're gonna grab a barbell. This is a 33 pound. The reason I'm using this one is because it's thinner and it hurts more. So you're gonna grab the barbell, you're gonna tuck it up underneath here. So right now the barbell is tucked underneath. So let me turn this way just a little bit so you can see what I'm doing. So the barbell's tucked underneath in between my hamstring and my calf. My feet totally plantar flexed, and then I'm gonna just sit down on it and I'm just gonna roll away. So I'm just grinding away. Oh, that's horrible. And then you're gonna roll it down a little bit, and same thing, grind away, roll it down, grind away, roll it down, grind away, and let gravity do the work for you. When you come out of this, do not push on the bottom of this. It's gonna drive into your Achilles, into your gastroc, and you're probably gonna throw up a boot, so don't do that. So remember, you tuck it up underneath as high as you can get, and just start grinding away until you feel that tissue come unglued. And that's it. You want to free up your ankles, you want to make your squat better and get rid of your knee pain, it's exactly what you do. Free up the gastroc and the soleus, that whole calf complex, clear out that Achilles, get your foot working the way it's supposed to. Hey, I'm Trev, SmashweRx, hanging out at Delta. I'll check you guys out tomorrow. Have an awesome day.